And as a parent, you feel completely helpless when you can't help your child, and people are rushing all around in the ER, trying to hook up different things, giving her different IVs.
When we left the hospital, she was diagnosed with type 1 diabetes, Gitelman syndrome, and short stature. And that was a lot to choke down as, mom and dad, because we took her in thinking she had a stomach bug. And so when they started finding all these other problems, we were just, in shock.
You're completely helpless. You can't do anything. You just sit there and watch, sit there and hold her hand, sit there and beside her and reassure that she's going to be okay. And then when the doctors tell her, okay, you're diabetic, and that means you're going to be taking shots, you're going to be dependent on insulin for the rest of your life, and trying to explain that to a 12-year-old and letting them know, okay, it's as much as you're terrified of needles, now you're going to have to, that's going to be part of your life forever.
Before Kaylee was diagnosed, she was a go-getter. I mean, she was just wired. She had so much fun. She laughed, she played, she ran, she romped, she did everything. Showed pigs, showed cattle.
Sometimes I can't go outside and play because sometimes it's too hot and my hands start going sweaty. Then I know I need to go to the nurse or I need to go to my mom and dad. And so it's most of the time inside. I'm in the nurse's office resting or at home resting too, because I can't do it in the recess or PE because I get too low.
She sleeps in our room, so she doesn't have the independence to go upstairs because she has to be close to us. We check her all night long.
We're cautious and nervous about the fact that she could go down at any point in time. If her blood sugar drops, she could fall down, have a seizure immediately, and then we would need to be responsive right then. So
we're hoping that Kaylee's service dog will be able to give her some independence to be back in her room where the dog can alert her, because Kaylee is what's called hypo-unaware. When her blood sugar drops when she's asleep, she doesn't know it.
My ultimate goal of having a service dog for Kaylee is to give her that independence and that self-confidence again, to feel like she's living a normal life.
He or she will be a life-changing deal for me because I won't have to be in the middle of the night checking my blood. All it'll have to do is just tell me or wake me up or go to my parents or my sister and just tell them that she's low or high. You need to do something. So that's what I'm grateful for, that she's going to help me with.